Hello, and thank you for joining us for our Women Veteran Town Hall. This is something that we do twice a year, and we're really fortunate to have medical media set this up for us. We have some folks that are on MS Teams live, and some people that are here in person, and some people that have called in. So, no matter how you chose to participate today, we're fortunate that you're here, and we appreciate it. It's a public forum, so please refrain from sharing personal health information in your questions or on the virtual online chat. And viewers on Teams may place questions in the chat. And a recording of this town hall will be posted to the Atlanta YouTube page for people that are unable to join us. Our agenda is we have some of our executive leadership that will introduce and kick off today. And then we also have some great speakers that will talk about some important women's health topics. Our first speaker is Dr. Kendra Lee, and she is the Associate Director of Operations, and she is going to come and speak to you right now. Welcome.
Good morning, everyone. Again, my name is Dr. Kendra Lee. I'm the Associate Director for Access, but I was covering for operations when this was set up. So as long as you know that I'm Associate Director, that's all that matters. Normally I don't read, but there are some certain things that I want to make sure that I share with you all today. So that's why I'm reading a little bit more than I normally would. So good afternoon. I'm honored to welcome our women veteran, esteemed colleagues and guests. It is a privilege to welcome you to the VA Women Veteran Forum, a powerful gathering dedicated to honoring your service and advancing the quality and accessibility of your healthcare. Today, I'm proud to highlight several remarkable achievements. Our self-referrals program has seen strong, sustained growth, empowering more women veterans to take charge of their health journeys. The increasing number of calls we receive is more than a statistic. It represents veterans' growing trust, improved outreach, and lives made better through prompt support. I'm especially proud to share that the Atlanta VA leads the nation in utilizing the external provider scheduling system, EPS. Atlanta is number one nationally for using EPS to create the soonest possible appointments for veterans. This includes you. This achievement matters deeply. It means less time waiting, fewer touch points and interactions, and dramatically reducing frustration. Our commitment ensures that no veteran leaves without an appointment. Every woman veteran who walks through our doors is met with the respect, efficiency, and compassion she deserves. Thanks to the dedication of our MSA assistants or medical support assistants and all the teams under the Access team and our colleagues, they are now equipped with business cards to ensure that we're enhancing direct communication channels between staff and veterans. The simple yet impactful change means that every woman veteran has a direct point of contact, someone she knows by name, helping to build trust and further streamline her care. These milestones are more than operational successes. They are signs of a healthcare system reshaped around you, our women veteran. Every improvement, every new initiative is driven by our commitment to support your health and well-being at every step. Thank you for being here today and for inspiring us to do better every day. Together, we are forging a future where every woman veteran is empowered, respected, and receives the world-class care she has earned. Thank you.
Thank you. We have a slide, Dr. Norval. He is the Chief of Staff that is over the Women's Program, and he sends his regards today. And I am Kathleen O'Laughlin, the Women Veteran Program Manager. Some of you I know, and there's some new faces here, so thank you so much for participating. The Atlanta VA Women's Program aims to provide all women veterans with high-quality comprehensive care and gender-specific care, so that is our goal. We want to do this in a safe environment and respect the unique needs of our women veterans. So it's important for us to have forums like this that are just specifically focused on women. We also do focus groups for our women. It's important to hear from you what's working and what's not working. Are we falling short? Are there some new things that we need to set up for you? And the good news is the focus group has helped us add additional programming for our women veterans. So your voice really does matter. And sometimes it's hard to believe that, but we are listening and we really value you taking time out to attend today. And if you do have questions for us, we want to answer that and address that. And again, this is one of our favorite things to do, is to be able to be here with you. We have almost just shy of 30,000 women veterans at the Atlanta VA, which is more than any VA in the nation. And because we have so many women, it really puts us in a position to be able to do some pilot programs and to start some new services. And we've been able to do that with our maternity program, with our GYN pilot self referral call, and with some of our research opportunities here. So we have an information booth outside that has all of those different programs and some information for them. But also know that you can call us, you can call your PAC team, any of your providers, and ask about the services that we have for our women veterans. One thing that you told us in the focus groups is you wanted more face-to-face opportunities. So we do a women's monthly meetup, and it is the fourth Wednesday of every month, and we do it at Post 66 in Avondale Estates. It's only a couple miles from here. And it is a great opportunity for our women veterans to get together face to face. It's from 10 to 12 o'clock every month. And they come in for some light refreshments. They get to connect with one another. And we have speakers. So one month it was cardiovascular health, another month it was menopause or fertility. We have preventative health at the end of this month. So hopefully, some of you all, if that's a topic that's of interest to you, you will come. Or if you at least want to learn a little bit more about other programs at the VA for women, we have some of those people there as well that can answer those questions in real time. And the good news is you get to see a lot of the other women veterans. It's multi-generational. So we have women from our maternity program. We have women from our postpartum program that come with their babies. So sometimes we get to hold babies as well. And then we have women who have served in every year since. So all ages, and it's great. This is an important contact information, the Women Veteran Call Center. So if you are traveling someplace and you know that you need to find a VA wherever you're vacationing or traveling, you can call them and they can tell you where to go. But also, if you're having a hard time getting your questions answered at our VA, this is the Women's Call Center. They have a great answer rate in real time. You can also text them and email them. So, and they're open 7 days a week to answer your questions and to send you to the right points of contact. And then this is the pink card. Some of our VA women's program staff that are also veterans created this, and it's called the Did You Know card. These are some of the topics that they found most veterans were asking them. What is offered for women veterans? How do we contact some of these numbers that are most in demand? And then the QR code is the national SharePoint, and there's so much information about women's program services. So, and they update it in real time. So it's a great resource for our women. It also has the crisis line on there and then My Healthy Vet. So we definitely encourage you to take a look at that. And so next, I get to introduce Dr. Jamia Pittman, and she is the Women's Health Medical Director here. And so she's going to talk to you a little bit about some of our women's health initiatives.
Thank you so much, Kathleen. Um, it is so good to see everybody. Thank you for coming. And we hope that as a takeaway from today, you understand what our mission is, what our purpose is, what new programming we've developed for you, and that we have provided you a way to give us feedback regarding how we're doing and for you to be able to contribute also to the shaping of women's health over the next 3 to 5 years. So I have some exciting news. I wanted to share with you guys that over the next 3 to 5 years, the Atlanta VA healthcare system has decided to prioritize women veterans' health. This is a big deal because this means that women veterans' health has made it to the strategic planning for the facility. Who determines this? The leadership. The director determines this, the associate director, the chief of staff, the chief nurse. The Women Veterans Program encourages it every year. Kathleen and I have been in our positions for 8 years, and this is the first time that we can say that we have made the strategic planning roster in this way. So this is huge. There are other priorities as well for the Atlanta VA. We won't focus on those today because we're excited about the women's health priorities. Yes, yes. The one of the reasons that we made the priority for this year is because we have one of the fastest growing demographic of veterans using services in the Atlanta VA for our women veterans. So women veterans are signing up. You guys are enrolling. We've looked at the market penetration. We know which counties you guys are enrolling. Fulton County is growing, DeKalb County, Cobb County, Clayton County, and one county that surprised me was Henry County, which is located to the south of the South Fulton mental health area, just kind of in that area. um, the women veterans are signing up. That means that we must have services co-located near those counties in order to reach the needs of the women veterans, the preventive health needs, the screening needs, the mental health needs. And so we've been tasked with creating a plan moving forward for our women veterans. We already have a lot in place, but now we're being asked to do even more. So this is a great time over the next 3 to 5 years to lend your voice to what you want to see occur at the Atlanta VA. Next slide. So while we're planning and preparing to expand women's health services, we also have to meet the needs right now. And so we've had to come up with planning and new services for the women veterans for now. And one of the new programs that we have is the GYN self-referral, the gynecology self-referral. Has anyone utilized this service? Anyone in the audience? Has anyone utilized this service yet? If not, that's okay. But if you have, if you raise your hand, I just want to know. I'm just curious right now. Okay, so this is new information for you guys. And so this is excellent. We were asked in the fall by the Secretary of the VA, who made a visit to the Atlanta VA, to create enhanced access for our women veterans, better customer service, and to be able to meet their needs in a way that does not require them to have to always go through a primary care provider. And the Atlanta VA took that request, which is really a directive, right? Because it came from the secretary. Seriously, we took it very seriously. And we came up with the GYN self-referral process as a collaborative. We utilized systems redesign, and it was a great collaborative effort. And Atlanta launched this program that is now spread across the nation and it's implemented at all VAs. And so basically, it's a referral line where a woman veteran can call and advocate for themselves regarding their women's health care. At the end of the line is a nurse that answers the call, triages, and then helps to navigate the care either to primary care, to gynecology, or to community care. Thus far, we have answered over 1,500 calls. We have assisted women veterans in getting GYN care at the main campus or in-house care at our Pike location, Fort McPherson location, and in the community. And one of the testimonials I'll share with you is that this is the voice of the veteran. A woman veteran indicated, from start to finish, the customer service was friendly, efficient, and genuinely caring. I've never been so impressed with the VA staff. The nurse turned a problem into a positive experience. So we're getting some good feedback. And this is an interdisciplinary team that helps the women veterans that call. The call is answered by an MSA, then a nurse triages it. And then if necessary, we also have a team of nurse practitioners that can see the veteran right then in a VVC Now visit virtually to address complicated concerns, and then we navigate the care forward. So we're really proud of that, and we hope that each of you gets an opportunity to utilize those services. The next new service that we have coming up, in the fourth quarter of this fiscal year, we will have on-site mammography at this location. This is huge, and the softness of my voice does not completely characterize how big this is. So, but I want you to know it's huge. It's something that we have been working towards for the last 5 years, and we just needed to have an alignment of all of the interest, all of the resources, all of the technical support. And we're finally at that point where we have everything in alignment, and we anticipate a launch by August of 2026, and more to come on that. But that answers our mission to increase access, to provide timely access, and to ease the care coordination. Because we know that when we get services completed within the Atlanta VA, the ease of access for that for our providers to look at the results and for us to see the results is preferred. We appreciate the community and love that they partner with us, but access to information from the community is not as streamlined. So when we can offer services in-house, it's a win for us all. So we look forward to that, and it's major. We have a breast health team. So we have a number of interdisciplinary teams, but I want to highlight the breast health team because they will be very impactful in helping to coordinate all of the breast care that's coming at the new programming here on site and to continue to offer community care coordination. And I won't go into their names and all of the specific information because I know that this is going to be on YouTube and you can pull it up at any time. And if you need to reach out to us, please do. But the purpose of this slide is to let you know that there's a team of nurses, nurse practitioners, MDs ready to assist in your breast health. Next slide. Sometimes we just have to focus on the data because our perception of what's happening may not necessarily be in alignment with what is happening. A lot of people are not data people. I am a data person, and so I have taken the liberty to include a few data slides. I hope it's okay. I wanted you to know that the Atlanta VA completes more breast cancer screening than any VA site in the VISN. We have screened over 10,000 women veterans for breast cancer this fiscal year alone and counting. And so we're on track to exceed the number of screening mammograms that we did last year through VA Community Care, which was a little over 11,000, because we're already at 10,000 and we have a couple of months to go in the fiscal year. This is wonderful. We coordinate care amongst over 40 vendors in the Atlanta area and beyond. And so we do want you to know that we take your breast health seriously. We take prevention and early detection of breast cancer seriously. And we want you to know that as a facility, it is one of the highlights of our services. We also take very seriously the potential increased risk that exposure to toxic substances creates on your breast health or just your health in general. And so we have prioritized addressing the Service Act. The Service Act is an act that Congress passed that helps us to understand that those individuals that may have been deployed to areas like Qatar, to Iraq, to Djibouti, or other places where there were burn pits or fuel toxins, or even some places that I may not have mentioned where toxins were in the area, that can impact your health and it can impact your breast tissue. And in some cases, we need to look at the breast tissue with a mammogram to determine if we need to seek services sooner to prevent and to detect any evidence of breast cancer early. So we actually partnered with another VISN 9, their clinical resource hub. We partnered with them to provide the screening telephone clinic visits, and they are on track. They started last week to reaching out to 3,000 women veterans who are between the ages of 30 and 40 who may have been exposed to toxic exposures. So be on the lookout for a call if you fall within that age range. And just know that this is a wonderful collaboration that leverages not only our interest in addressing this, but also in the VHA interest in working together to address this concern. Next slide, please. The last slide, which is a data slide, highlights our cervical cancer screening goals. We have completed more cervical cancer screening than any other VISN site, right? This is major. But guess what? It doesn't mean that we're done because our numbers are so high that even though we usually do twice as much as everybody else, we still have much more to go. And so we're at 73% compliance with cervical cancer screening. Our goal is to reach the national goal, which is 76% by the end of the fiscal year. How can you guys help us? If you receive your cervical cancer screening in the community, please download the result in a PDF from my charts from Piedmont or Wellstar or Northside or wherever you go, and send it to your primary care doctor through secure messaging. And if you are interested in receiving your screening at the Atlanta VA, you can call the GYN self-referral line to get access, ease of access to discuss that. Or you can secure message your primary care doctor and they will help to guide you towards getting that cervical cancer screening done. Ideally, we would like for you to get the screening done at your CBOC site. And so every year we have training that is sponsored by the Office of Women's Health to train our providers in how to do this cervical cancer screening exam in a trauma-informed way. But should your provider be male and you not prefer that or not feel comfortable, then we do have other clinics that we can invite you to get the cervical cancer screening done. And those clinics are at ABC, at Cobb, and also we're going to launch one at the Carrollton Clinic pretty soon. So those are my highlights. Thank you for listening, and thank you for your service to the country, and thank you for being here. Now we'll transition to Dr. Mariana Garcia. Did I say your name correctly? Beautiful. And she's going to talk to us. Dr. Garcia is going to talk to us about cardiovascular women's health. Just so that you know, hypertension is the leading diagnosis for all of our women veterans. When the doctors fill out the encounters, hypertension is the #1 diagnosis right now for FY26. So this is very, very appropriate for us. Thank you.
Thank you. Thank you. Yes, my name is Mariana Garcia. I'm one of the cardiologists at the Atlanta VA Medical Center. My focus is in advanced cardiac imaging, cardiac CT and MRI, but my other big sort of baby that I hold dear and close to my heart is advocacy for cardiovascular care in female veterans. And thank you to Kathleen O'Loughlin for inviting me again. I have 10 minutes, but my call to action is really improving cardiovascular care in female veterans. And why? Because female veterans are a very high-risk group that is significantly underserved in this regard. And so as we see here in this image, but as of last year, over 2 million female veterans in the United States. Our VISN happens to be one of the biggest populations for women veterans. And it's an important call to action because it's a very sort of interesting group in the sense that female veterans tend to be more ethically diverse. They also have a higher education level, but they also experience significant delays in terms of cardiovascular disease. Like we heard earlier, women veterans have a very high prevalence and burden of traditional cardiovascular risk factors, and we will also delve into those non-traditional risk factors. So my goal today is to bring just an ounce of awareness because really that's where it starts. And then more importantly, we are the VA. We are a very important hub for research. And so these are some of the examples of research that VAs have been part of that are female specific to cardiovascular disease. This is just sort of what I talked about, but I do want to point out that the women veteran population group has a bimodal distribution in age. And so we have that young population between 45 and 60, but more importantly, that very young population where we can be very aggressive with prevention. So with that next slide. And here I wanted to delve into that burden and prevalence of those traditional risk factors in female veterans. So as we said here, we're comparing women veterans to male veterans and then to civilians. And as we can see, obesity, over 44% of women veterans have obesity, and this is much more prevalent in African American female veterans, where it can go as high as 51%. Diabetes, about 11%, but as we can see, again, those Black female veterans, 2.5 higher risk of developing diabetes. And in those women veterans from the Vietnam era, we hit a diabetes prevalence of about 32%, so very high. Hypertension, we just heard about. We know that after age 85, female veterans actually have a higher prevalence and burden than hypertension compared to male. Lipids, we're also noticing that gap closing after menopause. So cholesterol sort of gets to that same prevalence as our male counterparts. And then, unfortunately, tobacco use. Very high prevalence and burden of tobacco use in female veterans, up to 28%. And in Hispanic women veterans, that risk goes 3.5 times higher. So this is sort of very eye-opening, I think, because we know about these traditional risk factors, but now look at just how much prevalence that is in our subgroup of female veterans. And this is really where we can approach significant prevention and really make a significant change. Next slide. Now, when we talk about female-specific risk factors, I've always said pregnancy is sort of like a natural stress test to your body. So if during pregnancy you developed gestational diabetes or hypertensive disorders, which we can see in this slide are much more prevalent in women veterans, that is a risk factor that we should be taking account to in our heart disease calculation. So very important. I think in all, if you have this in your history, always bring it up to your primary care doctors, always bring it up to your cardiologist, because it is a risk enhancer to being more aggressive towards preventing heart disease. And then again, here with this slide is the catalyst, right? Over 40% of women veterans report sexual assault in the military. So really this military sexual trauma, we know is sort of that clinical fallout and increases risk of cardiovascular disease in women. So it's all about this mind-heart connection and how that trauma, whether it be PTSD, depression, military sexual trauma, has to be taken into account in the future development of heart disease in women. And this, I think, is very important because when we think about psychiatric disorders, we know about this burden in female veterans, but how much risk does that actually carry? And actually, something that, a lot of us deal with, such as depression, actually increases your coronary risk equivalent to that of you being a smoker. So that is why I think it's so important to, think about these things and really take advantage of everything that the VA offers to mitigate these risks that we sometimes, don't even know have such a connection to heart disease. And then this is sort of just I just wanted to come up with like how it all connects with the female veteran and why you guys are such a unique high risk group to this. And so if we take into account all these non-traditional risk factors, PTSD, depression, and then we take into account what we know that there can be low medication adherence, lack of exercise, sort of avoidance of VA group care. And on top of that, all of that prevalence of those traditional risk factors, then we're ultimately going to come up with uncontrolled cardiovascular disease. And unfortunately, at that point, that's when you meet me. And it's so sad because I'm like, gosh, when I look back, there's so much more we could have done to prevent, this woman getting here. And sort of the final picture is, the cardiovascular health in women is not just the cholesterol and the diabetes. And yes, that's important, but we also have to understand how important all of this interconnected pathology involves. And that's kind of what I want to get to with the whole mind heart connection. So, we have to overcome the research gap. We have to redesign care delivery into a more tailored approach and ultimately bridge this disparity. And with that, I want to thank you.
Thank you so much. Thank you. We really appreciate that. Okay, and our next speaker is going to speak about external provider scheduling and community care, and that's Dr. Jennifer Fong.
Hi, thank you so much for the invitation. I'm going to share some exciting developments that we have in place at the Atlanta VA for helping to coordinate care better and sooner through the external provider scheduling program. And so with this program, we have outside vendors that directly present appointment options to the VA. So when a communicare scheduler calls you about your provider preference to see where we route your authorization, they can access the vendor schedule right then and there and actually make that appointment with you on that first phone call. And so what we've seen is this is greatly streamlined the overall process because we can get that appointment on that first phone call, get that appointment usually within a week or so. But that also saves a lot of that time that communicare will have to run down that appointment information if they had to do it through the traditional method. And so what that does is it helps us get to the next veteran, the next authorization even sooner. And so this is really, really exciting that we can help get veterans connected to care and also give you more information so that you can make the choice of where you would like to be seen based on when that appointment availability is, not just by location, address, where you might live. Perhaps you might drive just a little bit farther if that means you can get seen a whole lot sooner. And so it's been really exciting with the external provider scheduling program on the community care side. And Atlanta actually led the nation last month in coordinating appointments through the platform. They made nearly 1,500 appointments using the platform, and we're growing from there. And so we are working on expanding the providers that are participating on the network, on the platform, so that we can offer you those appointments and you have more options to choose from. And so what's even more exciting is because of the success that we've had at the Atlanta VA, they are now piloting this system that is very user-friendly with internal appointments. And I'll say we went live just about a month ago, and the Atlanta VA is already scheduled. They're going to hit 1,000 appointments today in less than a month. And the really, really cool thing, thank you. The really, really cool thing is that because the system is a lot more user-friendly and accessible, I've watched MSAs myself be able to locate those available slots and make the appointment in less than 5 minutes. And walking around in kind of the training scenarios, I could hear the phone calls. And with the traditional systems that we have to use, it's a very manual, burdensome process, and trying to find that appointment can be quite a challenge. And so if we can save them the time of finding the appointment with more accuracy, then that's going to help us overall just get veterans even more connected to care. So the team is on here training additional schedulers on how to use this new platform. But I think this is definitely the way of the future. And it's definitely very exciting that the Health Administration Service is very aggressively going after to try and get all their schedulers trained by the end of next month. And it's quite a lot of people all across the area. So this is just going to help Atlanta coordinate care better, both in the VA as well as the community. And then we'll go to the next slide. And so basically now this is now where we'll get really exciting about the potential for the future. So right now, unfortunately, it's kind of, you might be talking with someone at the VA coordinating VA appointments. You might be talking to community care who can do the community care appointments. But with this program, we now will have the ability to be able to schedule either at the VA or in the community. So you might not have to be transferred around to different departments, and you can look apples to apples on where those appointments are compared, whether it's at the VA at a certain location or in the community, and then be able to know when those appointments are and time so that you can make the best decision. And that's the future state, and that's really, really exciting if we can get to that. And I'll say it starts now with training everybody, and then cross training so that we can have internal schedulers and community care schedulers be able to do all of that in the same. We're not quite there yet, but this program is going to help us get there. And ma'am, I do see your hand.
Yes, I did have a question about that community care. I never went out before on that. Well, I think I went out there once before, but I always understood that you automatically got care being a veteran. But then I did go out there, and then I got paperwork back saying that my claim wasn't approved, and I thought, well, what's that? I just didn't know that you could deny the claim. So could you explain that, like what happens there, and like what I can do, because I thought it was a legitimate claim?
Oh, yes, absolutely, ma'am. That's a great question. And I'll say if we're talking about non-emergency care, because there is a different process for emergency care, but the VA does have to authorize care for that community care to be paid. And so there definitely could be some opportunities there. With emergency services, there is a different process that, you can't pre-plan emergency visits.
It said that, something like suicidal, but it didn't say anything like non-emergency care that I couldn't get here anyway. But it was just kind of like, what? I mean, being denied, what do you do about that? Because it had been authorized and it was shocking. So I didn't really think about ever using it again.
Claims can.
Well, you're scared because you don't know how much you're going to get billed for.
Absolutely, ma'am. If you did have an authorization, what we have unfortunately found is sometimes the vendors send the claim to the wrong place. And so that could be a challenge. And I'll say we do have a secure messaging group specifically for community care that you can ask a community care question, and then we can get that into the right hands so that we can look into your specific situation. But yeah, there are a lot of potential pitfalls.
Particular contact info I can get.
Yes, ma'am. We'll definitely get the info out. But for those of you
that was very concerning because I thought if they're going to offer it, I mean, I just thought I don't want to get denied, so I don't want. And then once I got out there, they tried to tell me that I should take this other procedure that I didn't want to have, and they said you have to take this in order to get this other thing. And there was nothing I could do about it. I was like, what? I didn't even want it.
And we can have somebody talk with.
And ma'am, we can have somebody talk to you after this meeting because we want to definitely help with the confusion around that with the billing. Okay, so Dr. Fong, thank you so much for presenting this. We're really excited about this in the ease of use. Our last speaker before we open up for questions is through our Veteran Benefits Administration and Disability Compensation. So it's Mr. Ricardo McKinley.
Thanks so much. Again, it's me? Okay. All right. Yeah. So from Veterans Benefits Administration, I'm just going to give you a quick rundown on VA compensation. You have 4 ways to establish service connection. Direct, and that's if you have an injury during service, short and simple knee injury. You're still bothered by that knee injury currently, that will be direct service connection. Secondary, if you're already service connected for a disability and something else is happening because of that, good example is a back injury, and then now you having pain shooting down your legs, radiculopathy. You can claim that second to your service connected disability. Presumptive, Vietnam veterans, Agent Orange, stuff with the PACT Act, a lot of those conditions are presumptive. Lastly is aggravation. So if you came in with, let's say, a knee injury from playing volleyball or something, and you came into the military and that injury got worse because of military service, that'll be aggravation. All right, next slide. All right, so some things you can do before filing a claim. You can get copies of your service treatment records. NPRC handles that. Now we do, we will get your medical records when you file a claim, but if you wanted to kind of comb through your own records prior to filing a claim, you can get copies of those. Of course, you review your problem list and examine yourself with any current disabilities that you have. So you'll have a stronger claim when you do file. And of course, see your current provider so you have current treatment, a good track record. Lastly, here's our contact information. If you want somebody to actually walk you through this process, we do have public contact services available. We have our number there and the link as well. The virtual claims clinic is really, really good. If you have an active claim, you'll actually be on with a rater or a decision maker to actually kind of talk you through some of the things that's going on with your actual claim. So I really recommend the virtual claims clinic. Yes, ma'am. Get it. It's gonna be, and be honest, there's nothing quick about it. It's gonna be through NPRC. Is gonna be the quickest way to be able to get them.
Is there a place here locally that I can go to and request my?
We won't be able to release them. And if you've never filed a claim, we won't even have them yet. We will have to request them and get them.
So is it that website that I go to
To make an appointment,
to make an appointment to request? Because I need my records before I move forward.
and I'll get you the NPRC. If you want a physical copy for yourself, I can get you
Yes.
that information so you can request it.
Thank you.
Absolutely. All right, and I think that's it. I think Q&A was, yeah. All right.
Well, now we officially open up for Q&A. So you thought you were off the hook. I did want to introduce Dr. Robert Norvell. He is our chief of staff and he is over the women's programs. Dr. Norvell?
All right. Thank you, Ms. O'Laughlin. As Ms. O'Laughlin says, I'm Dr. Robert Norvell. I'm the chief of staff, so I'm the head doctor at the Atlanta VA Hospital. I'm so happy that our women's veterans, Dr. Pittman and Ms. O'Laughlin, has these information sessions to let you all know what are the things we're doing. So I heard Dr. Pittman say that the leadership had put strategic planning for our women's veteran at the forefront. I was happy that she brought this to your attention because we know that our female veterans are growing and we see all of those things that military exposure has caused with the health of our female veterans. Breast cancer, cervical cancer, a lot of the things that we see. And so providing this information. Okay, so I got to tell you, they report to me. So these are my two direct reports. And so as a good leader and supervisor, I have to see what my people are doing. I didn't want to stand up here. I was sitting in the back watching what they do.
We found you.
And they do a great job. I want to thank you, and I will forever support Ms. O'Laughlin and Dr. Pittman. And the other thing is that Dr. Fong was the person that I pulled from some other place to come. And I am so happy because she's actually moving us into this century with how we can get our scheduling done, how we can integrate community care with VA care. If you've been in the VA a long time, you know that we know how to operate the VA, but the community is hard for us to get records back and things of that nature. So Dr. Fong is helping us to cross that barrier, not only for our female veterans, but also for our veterans in general, because she sits on that community care side. And sometimes doctors only know how to talk to other clinicians. And so when we try to talk to schedulers, we don't do well. But when we have a doctor that we're talking to, it actually helps us. So thank you all for being here. Thank you for asking your questions, and thank the two of you all for the great job that you're doing.
Okay, so now we have time for more question and answers. And yes, ma'am.
I have a direct question for Dr. Fong. I have an appointment that's been scheduled via community care. However, as of late, I've been suggested another doctor, and I'd like to entertain that doctor in lieu of the one that has been chosen. How can I make that change and make sure it's still properly authorized?
Yes, that's a great scenario. And so if you have been scheduled with the provider and you haven't yet seen them and you decide you want to go to a different provider, that is a perfect example of where we can reroute that authorization to the new vendor on that same authorization. Yes, ma'am.
What I was specifically told is they had to be in network. How do I find out that this doctor is in network and then move forward with making an appointment with that doctor?
Absolutely. I think the best way would be to ask community care to directly look that information up for you. There are on the provider locator tool that on the VA website, there is a ability for you to also look that information up. But just so I would recommend the ask a community care question if you have secure messaging, or call community care so that they could also assist you just to make sure.
Is there a direct number that I can get before I leave today for community care?
I can get that number for you.
Thank you.
Unfortunately, I don't know it off the top of my
No
head, but I have phone a friend and we'll get that info.
Thank you. And thank you all. I do definitely see the improvement. I can attest to it myself because I have been given the blues in the past.
Oh. Thank you so much for asking those questions too, because if you have that question, other people do. So they're able to learn from your efforts in sharing that.
I really don't want to sound like a complainer, but whenever I call into the general line, the main line, There is a very long wait. I mean, is anything being done about that? Because I know you need an extension, and even if you put the extension in, I mean, it takes forever. I actually get more done when I come in. But, you have to come in pretty often, and of course it's an inconvenience, to come in and park and all that and to schedule your day around it.
Absolutely.
But is
And
anybody are more
yes.
people being hired to answer these phones so that they can answer them?
This is a great question, and it is something that we do know about. Every morning, we have a meeting with the director, and we go over the timeliness to answering calls. And one of the things that we have found is that the volume of community care calls exceeds the amount of people that we have answering the phone. You guys already know. We have made some improvements, though. It was at a certain percentage, and now it's come down. However, oh,
It's not necessarily community care. It's
It's not.
just general.
oh, okay.
Generally calling into the VA.
Oh,
Yeah, it's not
okay.
specific to community care.
Well,
So,
in that meeting, we do talk about certain services and the call answer volume and the percentage of wait times, and we're doing better. But we do encourage, and it's not for everybody, but we do encourage secure messaging now because number one, we can understand what the concern is a little bit quicker. And we have some dedicated staff looking out for those messages. And the director has challenged us to answer those messages within 72 hours, and he's tracking our performance. And so I think that secure messaging may help. We're going to continue to improve upon the phone answering capability, but we're going to have to yes and it. We're going to have to use all the options that are available to us, phone, secure messaging, and then if you so choose to physically come in, and we can assist you that way as well.
and then I have another question too. I mean, what proportion of the veterans of the VA is dedicated to serving veterans, and how much of it is serving other people? Like, are we getting people from Grady too, or is it like what percentage of the veterans are being treated here at the VA clinics? Do you know?
It's all veterans,
It's all veterans because
100%.
I heard at one point, and it was years and years ago, especially when the parking got so bad, that there were other people that were coming here too. And I thought, well, we served, they didn't. And I mean, hey, I'm happy that it's good that they're getting care somewhere, but we did serve and earn this
Right.
ourselves.
No,
So we should have a priority.
absolutely. The VA is for veterans, and the enrollment process verifies that. And so we are happy to
So
serve
you're saying that
veterans.
nobody else but veterans are being served here?
Right. So this
Okay.
is for veterans.
Okay,
Yes.
thank you.
You're
Thank you.
welcome. Yeah. Oh, okay. And then we'll get to you. Okay, very good. I'm gonna get this back to you.
So sorry, but I think I have an A and B question too. First, Dr. Fong?
Popular today.
Yeah, and this is probably more general, but I like what you were speaking about, merging the things together. That's great. We do need something like that. Is there an aggressive and strategic plan put in place with this system to not just only make sure that calls are answered or people are getting services, but also do you have capacity to treat the number of people that will be calling in?
Specific to the calls, I know that
I'm
staff.
talking, okay.
Yeah, Paul.
All right, let me be a little bit more specific. Oh, I thought that she was working like together. Well, I won't communicate anyway. So listen though. So I just got a call for an appointment that I asked for a little while back. I've been asking for community care for dermatology. They finally did call me back for this condition. My appointment is in October. By then, I ain't gonna have no skin. And I'm just being real. Like, it is so disappointing and disheartening. But I also have to take into consideration I'm not the only veteran with a problem. And so I love what you guys are doing, but is there any way we could get these appointments not to be 6, 8, and 10 months away from like when we need it?
Absolutely, absolutely. And so we definitely want to get your information and try to troubleshoot for your case because you're absolutely right. That wait time is excessive, and we are mandated to schedule, and we don't always meet this particular mandate, but we're supposed to be in the ballpark range, right? So primary care new patient appointment within 21 days of request, and then subspecialty care within 28 days of request. And if we're not in that ballpark range, meaning, 30 days, 35 days, somewhere in there, then you can opt in for community care. And when the scheduler is talking to you, the wording is, yes, I opt in for sooner care because we can find that care in the community, before October. So that's what should have occurred. I'm not sure exactly what happened in your case, but we need to figure it out. So we'll
They said that
connect with you.
we got to have permission
Okay.
to yeah, like why y'all got to ask 13 people, can I go get my skin straightened out?
Right, right. And so one of the things that we're excited about with Dr. Fung's new process, right? The EPS, and it's being rolled out. It hasn't infused itself into all specialties yet, right? So there's a starting point. This time next year, we'll be celebrating this expansion of it.
I receive it.
Okay, but until then, we have to work on the issues and also welcome the new process. So we're definitely willing to help you with that issue. For others that may have something similar to happen, please send a secure message to your primary care team and tell them that you want to be connected to the Women Veterans Program to help resolve this wait time concern. And then Kathleen and I, we get on top of it. So with our team, because it always takes a team. It's not just us. It is a team. Thank you.
Oh, thank you.
Okay.
I just wanted to add one more thing is that the external provider scheduling program has also allowed us to have better insight into what the capacity is in the community. And that's helped us have conversations with those vendors. Hey, are you at capacity? We may need to find another vendor then to make sure veterans are seen timelier. And so it's just been another, not only the scheduling the appointments faster, but getting that insight and ability to have those conversations with our partners in the community so that we can get care at the appropriate timeline. So I think if we can get your specifics, then we can look into what is driving the delays, and then we can go from there. But thank you for posing the question. I know you said A and B though, but I don't know if we got both.
So my B is not directly for you, I don't think.
Okay.
It's just maybe this is already in place. I'm not exactly sure. I'm just now starting in May of 2025, starting to navigate this whole VA system thing. Y'all, it's confusing.
Sure.
You
I
know,
agree. It's big.
and it's hard and it's frustrating. I'm already dealing with PTSD, you know, and all this different stuff. So sometimes it's disheartening. Sometimes I feel worse after I talk to the people at the VA because it doesn't really seem like there's help. And then when someone says, yeah, we can help you, and this person gonna call and the next person gonna call, and everybody keep calling, but nobody is giving any answers for real or any help. So my question or suggestion is, can we have like a buddy system or something where somebody has already gone through these processes, and then like when new people come in, maybe they can start you, you know, like at the beginning and then help you until you get acclimated, because it's frustrating.
It is a big system. And even for us staff, we're learning new things about the VA every day because there are so many programs. It's great that there's so many resources, but it is confusing. So I'm with you on that. We do have a peer specialist program at the VA, and there are peers that are military veterans who, with lived experience, who actually have gotten their care here, and they are able to work with some of our veterans depending upon what programs you're in. So some programs already have these peer specialists that they can connect you with. So depending upon what program you're in, we have that resource. But I love the idea of just having the buddy system in general, because somebody who already knows how to navigate can give great directions in real time. So if after this, if you can touch base with me and we can kind of see which programs you are connected to, and if there are peers available for you. Okay, how are we doing on time? I just want to do a time check. It's, ooh, all right, it's 2:59, so,
Try and make it.
okay.
I retired in '99.
Mm-hmm.
I had some PTSD issues that they've denied me for several times. So I've been paying through TRICARE. Well, I'm not TRICARE for life, but TRICARE Prime for my own care.
Mm-hmm.
And it's out in off of Roswell Road. I live in Pine Lake. I'm now seeing Dr. M. That's my psychiatrist here.
Mm-hmm.
I was seeing Dr. Cunningham, but then I was told you can't have continual treatment. And they were going to reach out to somebody on the economy, I guess, to see if they will see, I guess, not just me, but other veterans.
Mm-hmm.
Can I give you all the psychiatrist I was seeing that I'm paying for myself when I was going out in Roswell, and see if y'all can pay for me to go out there?
So providers in the community can ask to be providers through the VA through Optum. So that's something that they can do. So there is a process about how to do that, and I'd have to find the subject matter experts here that can help you with it. But we will get with you if you can stick around at the end of this to
And my second
put
thing
you
is,
with the person that can help.
thank you.
We
My
have
second
one-
thing is, how do I pull up, if I go to secure message,
Mhm.
if somebody from the VA has contacted me, I
Yes.
can only contact back with them. But if I see somebody else within the VA system,
Mhm.
how do you go on that system, on the secure messaging, to pull them up? Because it's so many letters and
So
stuff you gotta do.
Is there anybody in here from Connected Care that can answer My Healthy Vet? Oh, here we go. So, thank you. We do have some experts that can help you navigate this.
Oh. Hey, my name's Natalie Davis. I'm the assistant nurse manager with Connected Care Clinical. We have what we call the Virtual Health Resource Center. We're located at the main campus on the first floor. It's not, can you hear me now? Yeah, across from in the Welcome Center. They're there Monday through Friday from 8 a.m. to 12 p.m. But then you say, how can you get help after that? We help you set up secure messaging, va.gov, login.me. You will have some, and say for instance, you get with your provider and you want someone to help you either on the phone, or you can come here or whatever clinic, and they'll come in with your device and help you get set up. Let your provider know, and they can go on the SharePoint. There's a VA directory, and they hit Connected Care, the provider will, and they'll see my name or the other assistant nurse manager name. Send us a message, and we will send someone out there to either call you or meet you here, unless you want to go to the main campus, and they will. Wherever you want to go, they will meet you at a VA facility, and it will help you get set up and resolve any secure messaging issues that you may have, or even with trying to get set up with your secure login.
VA.gov, I think I'm loud enough. VA.gov and My Healthy Vet. Why can I not have one login password for one? Like, I'll be in one and it tells me I gotta go to another one, and then I gotta put in another password. And I'm like,
That's all part of the system, but they help you get work through that, because sometimes what happens with people, they have multiple mailing addresses or cell phone numbers and email addresses, and the VA or the federal government is coming up with a more secure login, and they'll help you get work through all that. And sometimes it may take us an hour or two calling actual ID me or login.gov and get that, but we will have someone help you get through, navigate all that.
We had another final question in the back. If we could make time for that, I'd appreciate it.
Absolutely.
Hi.
Hi.
Okay, I want to piggyback off what you were saying about the peer
Yes.
specialist.
Mm-hmm.
Okay, and you said certain programs.
Yes.
So does that apply to mental health?
Yes, certain mental health programs do have
Okay,
peer specialists.
all right.
Mhm.
Well, I've been asking for one because I moved back here from Mobile, Alabama, where I thought I would be behind the curve there, which I wasn't. I had a peer specialist. and
Okay.
I've been back here since 2020.
Mhm.
Now, I was in the hospital last July, and that 30 days after I got out of the hospital, I did have someone contact me that was a psychologist, psychiatrist, someone else that was supposed to be the liaison to make sure that I got the proper care going forward,
Mhm.
did not do their job. She's still not doing her job. I hear more about her personal business than I'm telling her about mine.
Then can
I don't care
you,
for that. I've
can you-
asked for community care.
okay.
I was told I couldn't because I live too close to the VA.
All right. You know what I would love to do, because I don't want you to feel like people know your personal information. I
No,
want to
I know.
protect that, but I,
Kind of going through the same
Yeah.
thing here.
but I
With this
definitely
not
can
being
talk
able,
to
and then
you.
also with community care, being told that community care doesn't have a mandate to call me back within 30 days, that it could be 2 months, 3 months, or 4 months. That ain't doing me no good either.
Mhm.
That's all.
Okay. And if you can get with me after this so that we can look at that peer situation. Okay. All right. Well, I do want to thank my audience here in person and online for participating and for asking questions that other people can learn from. I think it's really a helpful thing when you take a risk and share some of your questions and some of the needs that you have, because then other people can benefit. So we do have to wrap up, and I thank you for your time, and we'll be doing this again in 6 months. Thank you. Bye-bye.